So we already know about abnormal psychology, and in this video we will learn about psychological assessment. Psychological assessment is really important for a psychologist before starting or before preparing any intervention plan for his clients. So let's start with today's topic, which is psychological assessment. Okay, so guys, let's start with our today's topic, which is psychological assessment. So now you are young psychologists. Okay, you know what are type of disorders are there, you know how psychologists think. So you are somewhere budding psychologist. So a budding psychologist should know how to assess a personality, how to assess a person psychologically. So today's topic will study what is psychological assessment, what it does or how it works, what is psychological test, and how psychological assessment and psychological test are two different things, and what are there in psychological assessment. So first, psychological assessment usually involves a more comprehensive assessment of the individual. It is more comprehensive. It is not studying just, we are in psychological assessment, we are just not looking toward any particular thing. We are assessing an individual. There is an assessment of individual. This process of assessment make use of psychological test or other qualitative method. Therefore, it is a process of collecting information which can be formal, informal, qualitative, and quantitative. Okay, so in psychological assessment, there is no limit. If you want to interview that person, if you want to know the case history, if you want to meet his family, if you want to use some test on that person, if you want to do some experiment on that person, if you want to want that person to do some action for you, so all the things you can do in psychological assessment. Psychological assessment, we look a person complete profile, a person's individual's complete assessment we do in psychological assessment. So psychological assessment is a process that involves the integration of information from multiple sources. Already we said we can interview, we can meet family, we can do some tests. Such are tests related to ability, intelligence, interest, attitude, as well as information from personal interviews. Okay, that's I already said. So it is clear to you what personality assessment is, what personality test is. Personality test is a different concept. We'll see what personality test is, but what psychological assessment is. Psychological assessment, we do a complete individual assessment. We are not bounded to any system. We can use any method we want to know the person. Now psychological assessment, let's continue it. It is now the definition of psychological assessment. It is an extremely complex process of solving or answering question, in which psychological tests are often used as one of the method of collecting relevant data. In psychological assessment, we have to know some variable attached to that person. We have to know the anger, we have to know the impulsivity, we have to know the anxiety, we have to know the level of depression that person have. Okay, or level of adjustment we have to see. So all the things we have to see in a psychological assessment. We can use some psychological test, to assess that variable. There are n number of tests devised to study all the variables: anxiety, depression, stress, family environment, n number of things. Anything you say, there is a scale for it. Work life balance, there is a scale. Quality of life, there is a scale. Everything, there is job satisfaction, there is a scale. So for everything there is a scale, and we can say a test, psychological test is there. So it can be a part of psychological assessment. A test could be there. Now understand this: the gathering and integration of data to evaluate a person's behavior, ability, and other characteristics, particularly for the purpose of making a diagnosis or treatment recommendation. We have to devise a intervention plan for a person who is suffering for any type of disease. We have to assess that person first. We know that the person, we have a case history, where we know that person is having, is diagnosed by this type of problem. Okay, if we know, or so if we don't know that person is diagnosed with any problem, so psychological assessment is required. Why? Because psychological assessment can provide us diagnosis for it. But if we know the diagnosis, the psychological assessment can help us to develop a treatment or intervention plan. Okay, psychologists assess diverse psychiatric problem. They're like anxiety, substance abuse,
or non-psychiatric concern like intelligence, career, interest in range of clinical, educational, organizational, forensic, and other setting. Assessment data may be gathered through interview, observation, standardized test, self-report measures, psychological and psychophysiological measurement devices, or other specialized procedure and apparatus. APA Dictionary of Psychology. We can use n number of tools, anything which is device to assess something in a person, we can use it in psychological assessment. This is the only thing we have to know. It is a, like, there are diverse psychiatric problem, there are a lot of type of psychiatric problem are there. We have to assess it, we have to treat it. And there are non-psychiatric problem also, like intelligence, career counseling are there. So career counseling, we use psychological assessment to assess that person on all the grounds, and then we decide and we predict which career will be great for that person. Okay, so that is how psychological assessment work. Now comparing psychological testing and assessment. So understand, testing is a narrow term. Testing is not do not provide us a complete profile of that person. So first thing, testing is a narrow term. Second, test is a standardized procedure of measurement designed to measure characteristics such as ability, personality, aptitude, and interest. Means it is designed to measure something. This is designed to measure only thing. The test, what it is standardized and designed for, it can only measure that thing only. Okay, it cannot provide at any diagnosis, and it cannot provide at any intervention plan. Okay, so test is just to measure something. Psychological testing, example, intelligence and personality test or mental test, occurs as a part of the process of psychological assessment that you already know. An objective and it is standardized measure of sample of behavior. We do not study the complete behavior in psychological testing. We sample of behavior, a type of behavior we study. Okay, what kind of behavior is there any concerning behavior is there or not. Okay, information collected is based on test only, so little is known of the client's behavior. So whatever the test whatever the test say, we I already told you, to know any variable we have to use psychological testing. So what variable? The variable is provided with what number, or we can say a result. Test have a result where we can say that we know a little about our client's behavior. If we know the aggression level of that person, we know family environment of that person, so we know that what kind of person it is. But we don't know, we cannot say the complete profile, we cannot explore the complete profile of the individual, but we can know something about the client. Okay, so next is it is a task upon which people are asked to try their best. Aptitude and achievement test, they measure maximum performance. Okay, so it is a task upon which people are asked to try their best. Yeah, whenever we hand over a mental test, we say, do your best, this is time provided, this is you have to done. We already given the test to that person, know how many things he have to done before the time end. Okay, but some tests are like some tests measure the speed, but some tests measure the performance. They does not measure the speed. Okay, so there are a lot of type of testing, but it is designed some way to examine the best. Okay, to test the best of the person. A test provide only part of the picture of person. Okay, it provide only a part of picture. We do not get a complete profile. Again and again, we are just the major difference we think between a psychological assessment and psychological testing is what? That test, psychological test, because you will get fooled by saying that we will do psychological assessment of your, and they will provide you some test and just test that thing and say that we have. If they are assessing you, there should be an interview, then there should be an MSc, there should be a case history, there should be n number of tests should be there. That will take time, so it will take time, so you will be called 2, 3, 4 times. But if a person is calling you and just testing you on basis, and you are this kind of person, that is not psychological assessment, that is completely psychological testing. So this is the difference between psychological testing and psychological assessment. We know what is the difference between testing and assessment, so we will not get fooled by anyone saying that we are gonna assess you psychologically. Purpose of psychological assessment. What is the purpose? Why are we doing this thing, assessment? Why are we assessing someone psychologically? First is self-understanding. The basic purpose of carrying out an assessment is for gaining insight in helping the client understand themselves better, helping them to know what they can do to and cannot do to including their strength and weaknesses. According to their strength, we can say that your intellectual level is this, so you should practice this thing, you should not get involved in these things. Okay, so self understanding we can provide to a person. Insight we can develop toward any disorder. If a person is having any disorder, if a person is having any behavioral problem, if a behavior should be managed, so that person should have self understanding, a person should have insight about that problem. So what in psychological assessment, our aim is to provide self understanding. Second is to diagnose a student's problem. Students, or we can say any person's problem, any problem is there, any problem our client have, so our aim is to diagnose that problem. To diagnose the client's problem in another purpose of assessment data fulfills. By using the data properly, we can interpret causal factors. It also helps to identify various aspects such as family background, physical health, academic performance, etc. Psychological assessment is a complete profile. So if we do psychological assessment, we can also diagnose a problem, because we know what kind of health he have, what kind of family he have, what kind of personality he have, and what kind of career he is having. So all this mix up, match and mess up his life, and what should be there, what should not be there. So we can diagnose a problem also, and we can also predict a problem. In some time this person will behave like this thing. Okay, third is to help in career planning and education. Career counseling is there. In career counseling, what we do is we do personality tests, we do adjustment tests, we do a lot of type of tests, we do interest tests. Okay, so a lot of type of tests we do, and then we complete a profile, and then we form a file where we know all the levels of it. We interview that person, we know his interests, what he is talking about, we interview his parents, what they expect from that person, then collectively we devise a career for that person. So that is how psychological assessment help us to help and predict the future of performance, that we already covered in the problem thing. If we understand the problem, we can also predict the performance, future performance, how that person is going to perform in future. To evaluate the outcome of counseling, if I have provided you some, if in the first day I have done a MSc where I have studied your mental state examination, and now after 1 month of and 4 we can say 4 sitting of counseling, I can assess you again and check if my counseling is working or not. Okay, in rehabilitation we also do the same. We provide the person insight, we do all of the things, and then we test the person if it is working on it. Then we shift to psychoeducation, then we shift to another type of counseling. So we can switch between counseling. There are n number of counseling, there are n number of processes where counseling is there. So we can switch between counseling processes, we can switch between therapy if we know what is mental state of, what are the if we know the assessment of that person, if we know the profile of that person at that time. Okay, after the counseling. Okay, so these are the purpose of psychological assessment. Now type of psychological assessment, there are n number of several categories and several number of psychological assessment is there. First is intelligence and achievement test. We know by intelligence we are talking about what? Intellect. We are talking about what? IQ. So there are n number of tests to study the IQ of a person. Okay, there are VAIS. Okay, Weiss Bhatia battery is there. There are n number of what they study specific intelligence, they study scholastic approach of that person, they study general knowledge, verbal skills, memory, attention span, all the things attached to intellect, cognition are studied in, not cognition only, but most of the part of cognition is studied only intelligence and achievement test. Okay, next is personality test. We study the personality of person. For this we don't use the simple test, we also use projective techniques too. Projective techniques, you know, for agar if we say in objective measures are there are MMPI, a test which is a psychological test. Projective test, there are Rorschach-Ingold test where we can assess the person psychodynamic and okay, there are personality assessment are there, Neo PIR, there are PAI is there, Neo PIR is there. So all type of assessment are there to assess a person's personality. We can assess a personal personality by using some psychological testing, by projective technique, by interviewing that person in some way, in some manner where we are exploring his personality. Or we can provide some tools to that person and ask him to do some action, and we can collect the data and we can observe the data and explain that what person is doing. So observation is there, testing is there, and also there is projective techniques are there. Okay, so these are two type we have studied of psychological testing. Now there are neuropsychological testing are there. Neuropsychological test consist of specially designed tasks used to measure psychological function known to be linked to a particular brain structure or path. They are typically used to assess impairment or injury, illness, affect neurocognitive functioning, or when used in research to contrast neuropsychological abilities across experimental groups. So neurological test, we can assess the neurons, we can see the neurons, we can do lesion, and we can study MRIs are there, fMRIs there, all the things are in neurological testing. Neurological testing is to study that might be this behavior. Neurological testing, we can say, is a biological perspective toward the illness or toward the assessment. Okay, so neuropsychological tests are there to assess what a person's personality or person's behavior on what ground, on biological ground. Now there are diagnostic and measurement tools. We already know ICD is there, DSM is there, DSM-5 and ICD-10 we are using now to diagnose a problem. So we can observe the symptoms by psychological testing, and now we can use these books, the God books of psychological assessment, the God books of psychological disorder, mental disorder. We can use that to diagnose that person, what the suffering, what the disorder that person is having. Now last is clinical observation. Clinical psychologists are also trained to gather data by observing behavior. The clinical interview is vital part of assessment, even when using other formalized tools which can employ either structured or unstructured formats. Such assessment looks at certain areas such as general appearance and behavior, mood and affect, perception, comprehension, orientation, insight, memory, and content of the communication. All the things are devised, and all the things are associated with some testing or some type of tools or some type of things. But clinical observation is dependent on the psychologist only, on the clinical psychologist, on the counselor only. He can only assess the skills. The better skills the psychologist have, the great skills the psychologist have, the better the clinical observation will be there. Okay, so this is up for psychological assessment. You guys should know that what psychological assessment is there, and if you want to be a good counselor, and if you want to be devise a good intervention plan for your clients, you have to know what psychological assessment do and how to practice psychological assessment. We will surely practice some psychological assessment in a few weeks. We can do practical. For that we have to be practical. Okay, we cannot learn all the psychological assessment by just reading them. We have to practice. We have to, if we are just talking about interview, we have to practice interview also, because we should know what question should be asked, what type of question should be asked. Okay, so this is up for psychological assessment. We'll meet in the next class. Thank you.
That's all for today's session, guys. We'll meet in the next video. Thank you so much for tuning up.